All right. Good morning, everybody. Welcome to today's live stream. We're going to be talking all about flexibility and how it can help back pain, and in some cases, how it can make recovery a little bit more difficult. So I'm going to go through the bits and pieces on the one side of the board and then get into a few more bits. There, obviously, we've got Laura on the other side of the camera. She's just out of view. She's taking down your questions. So if you do have any, please do post it in the comments below, and we'll get to those as they pop up at the end of the live stream. So first and foremost, I want to cover flexibility is obviously going to be helpful, generally speaking. We've discussed this on previous live streams. Just a little drawing of the hip here. If we've got flexible hips in particular, it means that the requirement for our lumbar spine to do the relevant ranges of motion, flexion, extension, etc. is going to be limited. We don't need to necessarily disrupt the lumbar spine while we have, let's suppose, a lumbar disc bulge. If we think of maybe the L4-5 or L5-S1 disc bulge, if we have no flexibility in our hips as we bend forwards, then we're going to have to come from the lumbar spine, squash that poor little disc even more, and make the problem worse. And we all know about re-aggravating these issues being a bad thing. So having flexible hips is going to decrease the requirement for lumbar range of motion, and it means that healing in the lower back can be less disruptive. And that is why there is a mobility aspect to the Back in Shape Phase 1 routine, which you guys will be doing throughout the Phase 1, 2 and 3 program if you're a member of Back in Shape. That being said, at that stage, we're not really working on increasing flexibility. And that's what we're going to talk about a little bit more in today's live stream. We want, yes, mobility, so let's do a little bit of work, but we know, we're safe in the knowing that this is going to have a limited long-term effect. We're not really going to be increasing flexibility, which I will get to later. Now, why may we not want to do flexibility or increase flexibility or try and increase flexibility at this stage? And it's important I stress, we're talking about different stages of recovery. We have what we call Phase 1, we're just starting to do that rehab program. We're not able to do certain exercises, we're in a lot of pain, a lot of dysfunction. We need to get some boxes checked, so to speak. For example, engaging our core correctly. If we can't engage our core correctly, it's no use doing a more complicated exercise because it's just an exercise in choreography and not actually an exercise in rehab. So it's worth bearing that in mind. Too much mobility in hypermobile patients decreases the stability and makes life more difficult because their muscles are having to work harder to stabilize that spine and stabilize that movement. And quite often, these hypermobile patients tend to have a little bit less muscle mass for whatever reason that may be. And their muscles that are reduced in size and competence are required to stabilize more mobility. And I draw the example of a nice little drawing of a man on a half Bosu board doing a squat. When we're on these sorts of devices, it stimulates our muscles more. They have to work harder, they fatigue faster because they're having to provide extra stability. So those, and we see this in the clinic anyway, those that do have hypermobility syndrome, they sometimes respond quicker in the short term to treatment and they get more relief faster, but they are often fraught with relapses as they work tirelessly to try and build up some muscular strength and competence. And this isn't, you don't necessarily have to be hypermobile to have this challenge because it is something that we see time and time again, that lack of strength and stability. But those that are hypermobile and do have increased flexibility above what you consider to be the average, do really find it difficult to get the momentum and move into sort of more robust rehabilitative exercises because they just have to build too much muscle before they get out of the woods, so to speak, in terms of risk zones. Remember, as we're going through exercises like Phase 1, which are relief-based exercises, the towel, the core engagement, some of those simple stretches, mobility stretches, as we're moving into Phase 2, we often find that some of these exercises, we can't do them very well or very efficiently at all. And as we go through Phase 2, maybe we start with 2 or 3 reps instead of 10 reps and maybe of the 3 sets. And as we're going through, that's quite difficult. And remember that as you're still in that Phase 2, those simple strengthening exercises, and we haven't necessarily made enough progress, you're still vulnerable. And if we've got more flexibility than the average person, then we are going to have to reach a higher level of competence in those muscles, Phase 3 for example, before we are safer than maybe the average person who may get into a safe position as they start to move towards the end of Phase 2. And then finally, this is really the secret, and we'll talk about this a lot for those of you guys that know about the upcoming, later today, flexibility program. timing is everything here, and I will touch again on this a little bit later. Muscle spasm. If you're in sort of an acute phase, or you've got back pain and it's quite severe, the muscle spasm, all of a sudden those muscles tighten up, the pain can trigger that. Weakness in the muscles and the neurological signals coming from these segments down here, down to those muscles that you're working to improve flexibility on, all confound and interfere with the success of a flexibility program. So there's absolutely no point doing it if your sciatic nerve is blasting away at your hamstrings, stopping them extend, because your flexibility is going to be so limited. You'll do the stretch, you'll get a bit of increased range of motion, then you'll go to pick up a pencil or something like that, or move to sit down, it'll jolt again, and all of a sudden you're tightened back up. So working on improving flexibility objectively is really, in my experience, totally and utterly pointless in this stage of recovery, and that's why we just don't put it in. Unfortunately, and this runs counter to a lot of other premises and other approaches, too many other rehabilitation programs and practitioners will recommend mobility and stretching as their primary mode of treatment at this stage, and it just doesn't really add up. And actually increasing the flexibility is a losing battle in the early days anyway. But considering this, it may actually be detrimental to the overall stability of that individual, because it's likely they won't be able to make the strength gains at the same time if they're focusing intently just on flexibility and stretching exercises. And there seems to also be in the patient's mind a mental block with actually doing strengthening exercises. It does seem to be, oh, I'm not ready for that, I'm not ready for that, I'll do stretching. So you're going to increase the mobility right now to make you less stable, and that somehow makes you ready to do an exercise to challenge the muscles when it's going to be a greater challenge after you've done that. It just doesn't add up when you start to break it down. So very, very important. I do want to cover though, that this is only most cases of lower back pain where those have muscle weaknesses that are the primary objective that we want to address. And the Back in Shape program was created based on our experience here in the clinic, dealing with the overwhelming majority of lower back pain cases. And a lot of times our advice in the Back in Shape and what we talk about on the YouTube channel on these sorts of lives maybe runs counter to other clinics and other professionals that you've spoken to, but in a lot of cases those sorts of professionals are dealing with everything. They may have seen 1,000 patients and 500 of them have been backs, or 5 of them have been related to the spine, and 300 of them have been related to the hip, and some of them have been knee problems, and some of them have been bursitis and this, that, and the other. But here at the clinic, and even before the Mayfair Clinic existed, all of our experience is on the back. That's what we do day in, day out, and that's where these nuanced differences come in, and why they work as well, as many of you in the Back in Shape will know anyway. But there are some cases where this is not true. And I'll put a little exception, because it is sometimes the acute cases. And I will add the caveat here that those people would be the guys in the gym that have had a robust physical exercise program for an extended period of time. They're very, very strong, they're gym goer guys, and we do see some of those in the clinic. But the chances are you wouldn't be watching this video if you were one of those. And we make these videos to try and be as applicable and as relevant to our audience and those of you that watch us. So we don't talk about these sorts of patients because they are in a very, very small minority. And what does happen is if these aren't dealt with properly, the healthy, fit, strong guys and girls that do unfortunately injure their back, they normally bounce back very quickly anyway, because their body's in a good state, a good condition physically, biochemically, they're sleeping well, all these other sorts of factors are in their favour. But sometimes it is dealt with badly, and then this begins to descend and the fall from grace, and sometimes you do see those athletes after 6 months to a year of not doing exercise. And from personal experience, and many of you guys watching this, given the last 6 months, will be able to testify to this as well. Even with 4 months of not going to the gym during lockdown while they were closed, I lost a good degree of muscular stability and support in all the areas of my body that I work out in the gym, and I didn't have an injury, let alone someone who's got an injury and all the other complications that may or may not bring. So it's worth bearing that in mind. That's why we don't discuss that too much on these live streams, because it is a very small minority of cases. Finally, getting to the crux of today's live stream. Flexibility is important. Flexibility helps protect our lower back. Working on mobility in the early stages of what we would call the Back in Shape program in phase 1 is going to be a help. We're not making any estimations or attempts to increase our flexibility at that point, merely combat the declining stability or the declining state of stiffness that can occur, and try and do a little bit to combat the spasms that may occur from the pain. But we're not making any change to the flexibility. But there is a right time for the right things, and that is where we move into phase 3, and that's why we've put together the flexibility program, which will come out later later today. In fact, we're just making, Lara and I make some final few tweaks to that, and that will be launched to all the premium members. I would really encourage you, if you are watching this and you're part of the Back in Shape program, please, if you're in phase 2, don't jump ahead and do the flexibility program until you're in phase 3. When we do work well with the right sort of stretches and work objectively at the right time in conjunction with strengthening programs, the research shows that it can be really helpful for a person's quality of life, stability, strength and endurance in their lower back. And that's why we put all this information together. A lot of times people follow it to the letter, which is awesome, but sometimes there is that temptation to jump ahead. Oh, I know my hips are stiff, I'll just do the flexibility program now and I'll skip phase 2. Don't do that. Doing the right sort of flexibility at the right time and building flexibility can be really, really powerful, can be really effective, but we need the muscular support and competence to deal with that increased range of motion, and we need to have our back in a better condition to be able to deal with that. So that's pretty much it for me. Move over to Q&A.
Okay, awesome. Morning everybody, please do pop your questions in the comments below. I just wanted to ask you about yoga, because yoga is kind of stretching and strengthening. What if people are sort of thinking, you know, you've spoken about the stretching, maybe I can get away with a little bit of yoga whilst I'm doing phase 1 and incorporate the 2, because it does sometimes happen. What are your thoughts on that?
I think that the one area where we get people fall foul with regards to the Back in Shape program is where they try and combine it with other things that conflict. And that's the unfortunate truth. We will do a bit of, and sometimes, and it is rare, I do stress that, we'll speak to someone who maybe they're doing the Back in Shape program, but they're also doing knee hugs at the same time, and I'm thinking, well, please don't do that. You know, it doesn't help, and we've discussed before, you could do all of the right things, but if you're doing a few wrong things, that can really derail the rehabilitation process. We're giving you the tools. Maybe in this case, in the flexibility program, it's half an hour to 20 minutes. In the other Back in Shape exercises, it's half an hour to 20 minutes a couple of times a day. Maybe it's an hour and a half max a day of you doing the right things, and many of you are so diligent with that, and it's fantastic. But if we are spending the other X number of hours, 10, 15 hours a day that we're awake, doing the wrong things and doing other things in addition, then we are really going to really derail the process and the progress that we make with regards to the Back in Shape program. So please follow it to the letter and don't do those other bits and pieces. Now, when it comes to yoga specifically, I personally view yoga as a difficult thing to do. It requires complex movement, it requires complex flexibility, and it requires complex strength. It is a high skill activity. Getting into yoga when you've got back pain is not a good idea. If you have the desire to do certain exercises in yoga or move into yoga, once you've done the flexibility program and you are flexible enough to do yoga, for example, a downward dog in the correct posture, then by all means that may be a good additional variation that you could throw in towards the end of what we call the Back in Shape program. It's something that you could do in sort of that maintenance phase, if you will, because you also have the knowledge, the movement patterns, etc., to be able to do those sorts of exercises correctly. But yoga is a challenging activity, especially certain variations. And also bear in mind, some of those exercises really aren't necessary. In terms of things like the child's pose, I know it's a favourite because it feels nice, but there's lots of things that feel nice that aren't good for us, and we should really bear that in mind. What is this actually doing, this child's pose? How is it exactly helping me? And by aggressively, and I know I say aggressively because the range of motion is aggressive here. I can't do this to the spine, but you'll get the idea. By aggressively pulling this round forwards and flattening all this out and stretching all the little ligaments along here, none of us need that. Most of you watching this video right now probably sat down, hopefully many of you with very good posture, but many people watching this in the future, because I know these get views after the live, will be slouched in a chair watching this video. I hope not, but maybe that caused you to sit up. We do not need more of those sorts of activities, more of that rounded flexion posture. It's not helpful, it's just reinforcing something that we do plenty of every single day. So please do, those sorts of things are okay. But maybe we need to do a specific live stream at some point on guidance for when and where to do things like yoga. That might be useful.
Alex has asked a good question here. He said, could you give a definition of what is adequate hamstring flexibility? I see some videos of people who can flex their leg all the way above their head. But I think this must be unusual.
You're going to have to wait for that until later this evening, because we do put some accurate range of motion studies for the hips in particular inside the flexibility program, so you can have a look there. But in essence, a lot of those extreme range of motion, the splits, etc., they're not necessary. You can pull them, but without getting into too much detail, essentially you have a bunch of muscle units inside the muscle, and they've got subunits, etc., and so on. We did it on the collagen one. We didn't do muscle fibers. Anyway, muscle fibers, there's some similarities, but you've got a bunch of things, and in between that you have collagen as well. And some of those stretching are just pulling the motor units apart and stretching the collagen parts of our muscles as well. So there is a limit to what is actually necessary. We don't, and that's part of my gripe with certain activities in yoga. There is no reason for you to need to be able to get your head on your toes going backwards. It's not necessary. It's not really helpful, and that starts to move in towards the realms of hypermobility. And bear in mind what I said at the outset of this video. The people that struggle the most with those hypermobility, and quite often those are young people that start doing those exercises. They get into gymnastics or ballet or dance, and they do that for the sake of that sport, but that's not for the sake of their health, that's for the sake of that sport. And like most sports, no difference to NFL with concussion injuries, they have lasting impacts on our bodies that are not necessarily good. High-level sport, in the overwhelming majority of cases, is not good. You've got even something like golf, where you've got Tiger Woods, who's had spinal surgery. The repetitive action that is required, the diligence, the care and the devotion to these sorts of high-level activities, be they dance, golf or American football, they are not good for our bodies. We are pushing them to the limit by definition. So taking those examples of those people that can do extreme things is not applicable to the general population, let alone a program that's designed to help people with their back pain when they're in maybe a more vulnerable condition or position. Hope that helps.
Okay, awesome. Yes, Alex said awesome. Thank you. Sally said excited to see the flexibility program later. It will be launched this evening. Very excited to launch it too. Got another question here from Zenaida. She's commented on yesterday's live stream. She's asked, in regards to scoliosis, is deep body massage good for the condition?
My personal point, and I know this because I've got family members which have this, it's very, very important that we don't try and work excessively with massage. That's not what's going to protect us, in my opinion. The main thing that we need to do when we have a left to right deviation is provide support, stability and protection. That is really the overwhelming goal. We have altered structure, slightly abnormal structure when we have a scoliosis. That spine's just feeling a little bit vulnerable, so I'm not going to put it off to the side, but if we've got the spine going off like so, providing a greater support structure in this midsection to provide compression like so helps move it back towards the middle, or at least oppose that pressure, because as we press down with gravity, this is going to want to go the way it's going. Whereas when we have a straight spine, as we press down on gravity, you find that from the side, the curve changes. Okay? When we're looking at it from the front, the curve will change from the side, but also if we're leaning off to the side, as gravity presses down, this isn't going to miraculously move to the middle, it's going to stay off to the side. So what do? You work tirelessly in perpetuity to increase the strength, stability and protection that your core muscles, your back muscles and your lower body muscles can offer your spine. And that is something that you have to do for the long term, stay active and really try and avoid getting caught out and becoming inactive. I really can't stress that enough. Those that have abnormal structure and scoliosis would come into that. We must not go through periods of excessive inactivity, because you will suffer more. And the problem with that is that then when we get caught out into that inactivity cycle, you lose more muscle strength, then you can do less, and you have more pain, so you do less still, so you lose more muscle, and it becomes a very difficult hole to drag yourself out of. Please, 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 for you and anyone else watching this that has those sorts of issues, muscular strength and support is something, regardless of whatever else is done. In some cases, in younger individuals, you get things like the Harrington rods, where they bolt rods to your spine to help you. In some cases, the rods then get bent by the process because the process isn't dealt with properly, but that's by the by. You can always improve your muscle strength and stability, and try and do it in a symmetrical way. Massage work symmetrically through the body, I think, is sensible. And using things like the vibration guns that we have here is sensible, but trying to over-massage one side versus the other yourself is maybe not the best approach, and it cannot be done without diligent exercises, so that's a really important one.
Awesome, I hope that helps, and I hope you also caught that. Kate has said here, every time I sit down now, I can hear you say, posture, don't slouch. It does actually work for me too, Kate.
There's a little interesting device that I've been thinking about doing a review on for a little while now. We talk a lot about posture braces when you're sitting down, just on the topic of this conversation. And there is a little one, and I forget what the name of it is, but we need to look at one of these, where it's basically two sensors. Because I'm very critical of using posture supports. And if you've got a little voice in your head, that's good, as long as it's not too many voices. And that will help you consciously stand up. But these devices, it's just like a sticker, and you stick one here and you stick one here, I think, something like that. And then it buzzes you, because it's Bluetoothing the two of them together. Now that may create issues with other things, but at least it gives you a little buzz when you're slouching to wake you up, so or to put you back in a good posture. So something cool.
Yeah, we should definitely review one of those. I'm interested.
Yeah, they look really good, and it's not supporting you. That's the cool thing. It's getting you to support yourself, and it is a reminder that will become probably very annoying unless you sit up straight. so something maybe for the giveaway next month.
Yeah, awesome. Okay, fab. I think that is everything for today. Thanks everyone for your comments and your questions. Hope it was helpful.
Thanks so much, guys, for joining us. Thank you for the questions as well, and hopefully those answers were useful. And hopefully this helps you a bit with flexibility. I know maybe it's a little bit counter to what you've heard in the past, but hopefully it does make a good degree of sense. We're always trying to go into the details of why we say what we say. That's why we've got these longer videos rather than the 1 minute video. Don't do flexibility now, do it later. That's not necessarily so helpful. So hopefully the explanation was of use to you guys. And again, the flexibility program is being launched later today. And we are also doing it with everybody, aren't we? Yes, Lara and I will be doing it as well. So there's you're going to read about the testing phases, you're going to read about the different stages that we've got through that flexibility program, starting out with certain things, feeding in others. Should be really engaging, really useful for you guys. And hopefully, for those of you that are approaching phase 3, something to really look forward to kind of take you to that next level. So really excited about launching that. That's the first major addition to the Back in Shape program that we've had in a little while. And it really does start to round it off really nicely. So if you're not already a premium member as well, there will always be a link somewhere under here to upgrade and join the premium program. Plenty more new things to come over the coming months as well. So thanks so much for joining us, guys. Have a great day, and keep your eye out for tomorrow's live stream and the flexibility program tonight. Thanks, guys.